after all that, let me bring in our next fantastic guest, who we're very, very lucky to have. Camila Asano is the co-study of a study looking at the response of the Brazilian government, the far-right government, of course, of Bolsonaro. She's the co-author of this critical study. Over 231,000 people have officially died in Brazil since the pandemic began. It's one of the worst affected countries on earth. Should be said, doesn't have a death rate as bad as Britain, which doesn't let Brazil off the hook. It just shows how horrific the situation is here. Camila, thank you so much for joining us.
Hi, Owen. Thank you for having me here and having this opportunity to share the findings of our research and the study.
So just and it's a pleasure to have you, just this line, which really very striking. Our research has revealed the existence of an institutional strategy to spread the virus promoted by the Brazilian government under the leadership of the President of the Republic. Do you want to just explain what was meant by that?
Sure. So in this research, what we did is a partnership of Conectas Human Rights, that's a Brazilian NGO working with human rights, and the University of São Paulo, the center research from the public health faculty, CEPEDISA, and we joined forces to map and analyze all the regulation from the federal government as a response to the pandemic. So basically, we had a team of researchers analyzing daily the production of laws, executive orders, or provisional measures, decrees, decisions, resolutions. So in different levels, from law to these decisions that were all produced by the federal government as part of the response to the pandemic, and analyzing all of these. And in the end, we analyzed more than 3,000 norms. I'll call generally norms. And what we saw is the findings of the research. So the first one is, and this is a very important message that we wanted to spread to the world, that it's not correct to reduce Bolsonaro's response to the pandemic as a neglection or an omission, or just saying that, well, he could have done more, but he decided to do nothing. This is a small part, if I may say, of the reasons why Brazil is the second highest COVID-19 death rate in the world, and considering, according to some research, one of the worst response to the pandemic. So doing nothing is one part, and I may say just one part of this. But we had three findings of this research that will come to that conclusion that you mentioned, Owen. So the first one is Bolsonaro, President Bolsonaro proactively decided to veto or adopt measures that in the end didn't contain the spread of the virus, but instead was promoting actions and behaviors that were spreading the virus. So this is one of the findings that we saw analyzing these 3,000 norms produced since March 2020 until January this year. The second finding is that Bolsonaro was also blocking measures that state or municipal governments adopted to protect population from the pandemic. So it wasn't that he was just adopting measures that was spreading, and I'll give you some examples, but he was also blocking and obstructing when governors, for instance, were trying to impose some measures to curb and contain the pandemic. And the third finding is that while we were analyzing these 3,000 norms, we organized in our study a timeline. And when you put in this timeline, the measures with speeches from the President Bolsonaro to the press, to followers, in his Twitter, we can link and see and that's the third finding of the research, a propaganda against public health. When he is claiming that, well, this is just a little flu, so there's no need to use mask, or promoting, medicines and remedies that are unproven to be used as a treatment for COVID, and actually some concern about being, harmful for the health of people. But his was fostering the population to use, and even giving directions for medical doctors to use it. So when we use sum up all of these findings, in the end, what we have is that Bolsonaro's actions did not contain the spread of the virus. Quite on contrary, it actually facilitated. So it is true that there was an intentional way of behavior of blocking and measuring measures that could help people. So this is a very concerning conclusion of our study, because in the end we have this large number of deaths, but so many avoidable deaths, especially because Brazil, we have the universal public health system. So I'm not saying that it's perfect or one of the best, but we had all the conditions to deal with the pandemic in a much better way if it wasn't President Bolsonaro's active intervention in so many cases to, instead of supporting measures to contain the virus, actually he was blocking measures that could protect the population in this pandemic crisis.
I mean, you spoke in the research of a constant war being waged against governors and mayors who were trying to implement measures to prevent and fight the virus. So it'd be interesting to hear a bit more about that. And also, linked to this, in Manaus, is that how I pronounce it? Is it Manaus? I'm never sure how to pronounce it.
Manaus
in Brazil.
You're almost there.
Almost there. So this is a city over 2 million. It's by the rainforest. And it had such an initial awful outbreak that many people thought it was one of the only places on Earth to have achieved herd immunity. But then what happened is it was hit by a second wave in which a new variant of COVID, one of the very disturbing variants of COVID-19, have emerged, which poses a big threat to the global, not just Brazil, the global public health response to it. And that's the other thing, isn't it? Because the warning was always, if you allow the virus to run amok, it increases the risk of variants which can evade vaccines and treatments and which can prevent us going back to some sort of normality. And Brazil's catastrophic approach, like Britain, it has to be said, made those variants more likely, for which the world then has to pay.
Yeah, so one of the findings of our research is how there was this kind of war declared by President Bolsonaro to governors that were trying, some of the governors, not all of them, were trying to establish some measures to contain the pandemic. So one is closing businesses. So this is what we never use the word lockdown here, but there was a moment that governors decided to shut down and to close shops that are not considered essential activities. What Bolsonaro did, he adopted a decree, or he signed, because he's the president, so he has the pen, he holds the pen. He signed a decree expanding the list of essential activities to include gym and sports centers, to include beauty salons as essential activities. Because when we had this kind of, between commas, lockdown here in Brazil, there's still, markets, supermarkets open, pharmacies open. But as this decree included gyms and beauty salons as part of it, it was also a way to diminish the measures taken by some of the governors. In the case of Manaus, Manaus is the capital of the state of Amazonas in the north of Brazil. And Manaus is kind of the open to the rainforest, the open door, the door for the rainforest. And it's a big city, as you mentioned, 2 million people, the population. So it's a big city, but quite isolated because of geography. So you cannot reach other capitals by road. It's only by river. So it's really hard to deliver supplies in Manaus. And we had the first case in the beginning of the pandemic in 2020. Manaus was one of the worst city cases in Brazil. And we had people from Bolsonaro's cabinet saying that, no, we're going to see, because they are reaching this herd immunity, and this is our case study. But it's been proven that there's no herd immunity. And the governor Amazonas, where Manaus is the capital, in early December, decided to impose a new lockdown because he was seeing that was this second wave that here in Brazil, it's hard to call it second wave because it seems like it was only the same tsunami since the beginning. And the governor, by decree, also impose a new lockdown, and there was demonstrations from business person and going to the street and organizing marches against closing shops and closing businesses. And because of this pressure, the governor went back and canceled the lockdown, and this is what we are seeing now. So the number of deaths is increasing, and we had these horrible scenes of families begging for oxygen and people dying in hospitals because there is no oxygen supply, and it's quite complicated to send oxygen supply because it cannot go, by road because you don't reach Manaus by road. So it had to be by planes, and there's a whole security measure. So a specific kind of plane can transport the oxygen supply. So in the end, we still don't know how much lives we lost because of this crisis of oxygen supply. And the Minister of Health went to Manaus a few days before this crackdown of oxygen supply. So it was all aware, including there is an investigation investigating the Minister of Health, that's the armed general, because again, in Brazil, we are having a far-right president that put military staff with high-level ranks in high-level positions in his cabinet. So the Minister of Health today in Brazil is an armed general with no previous experience in health crisis, and he was chosen because he was supposed to be good in logistics. But if you look what happened in Manaus, well, logistics for sure wasn't there.
Finally, I mean, you said in the report that the situation in Brazil would be even more tragic if other Brazilian institutions hadn't stopped many of the measures which were encouraging the spread of the virus by the Brazilian government. So just finally on that, and secondly, what now for Brazil? How optimistic are you? I mean, I've seen Bolsonaro spreading anti-vax type sentiments, suggesting if people get the vaccine, they'll turn into alligators. I don't even know what to say.
It didn't happen so far.
Yeah, just to be absolutely clear to everyone watching, no one has been turned into an alligator as things stand because of the vaccine. Very important to make clear there was no evidence base for transforming into an alligator. I mean, is there hope for Brazil given, I mean, where does the vaccination program stand? Obviously, a lot of the global south, there's lots of big questions regardless of who's in charge. So what on those two things, just how actually it could have been worse, but actually, is there still worse to come?
It's very bad and it's very serious, but could be worse if democratic institutions weren't blocking these measures from President Bolsonaro. So at Conectas, we are all the time analyzing from the human rights perspective the Bolsonaro response to the pandemic. And we have to be aware that Bolsonaro was, before the pandemic, an authoritarian populist leader. And before the pandemic, he was even at the election campaign in 2018, when he was elected in 2018 and took office in 2019. So when he was elected, his electoral platform was anti-rights and talking about, well, there's too much rights for those minority groups. So he was being questioning, and in the end, when he took office, he put in practice a policy to remove constitutional rights from the population, from indigenous people, from quilombolas, from people deprived of liberty in the prisons, because Brazil has a mass incarceration rate, migrants and refugees. So if we look at this platform of removing human rights from especially vulnerable groups, it's comparable that when Bolsonaro started to deal with the pandemic, because it took a while for him to deal in this disastrous way, but the human rights perspective of it, it's really a disaster. So first one is the right to health. So we have the second highest COVID-19 death rate. So he's failing in protecting the right to life as the basic human rights. Also vulnerable groups, and he was neglecting protection for these people before pandemic. So during the pandemic, it didn't change. So only the Supreme Court or the Congress forced Bolsonaro to take measures. So when we think about, all the measures for the indigenous population, it was the Supreme Court combined with the Congress that are the responsible for forcing Bolsonaro to take some of the measures. They are not enough, but some of these measures taking was because of what the institutions, as you mentioned, one of the quotes from our research says that. So if it wasn't the Congress, there would be probably any preventive measures. If it was for the indigenous people, if it wasn't the Supreme Court, we perhaps wouldn't have a national plan for vaccination. That's your second question, because the government was just saying, oh, no, don't worry. When the time comes, when we have the vaccines, people will be vaccinated, and we will show the plan once we have the vaccines here. What kind of planning is this? And we're talking about pandemic. So the government only presented the national plan for vaccination because the Supreme Court forced the administration to do so. And you asked me how is the perspectives for vaccination in Brazil. It's a nightmare, because we should be in a so much different level now. So it's less than 2% of the population vaccinated so far, and we are still struggling to have the products to come from China to produce the 2 vaccines approved here that we have from the CoronaVac and the Oxford AstraZeneca. So we are not autonomous. We don't have autonomy in production. We still need to get the supply coming from abroad, coming from China. And Brazil is one of the countries that has a long-term history of experience and expertise in vaccinating and even exporting vaccines and exporting this know-how. And now, because of this policy of denying science, denying public health system, we are where we are now. So there's no even perspective for the young people. Like I don't even know if this year I'll be able to get my chance to be vaccinated. And on the other hand, Bolsonaro is always saying, no, we cannot stop economy. And this was since the day one of the pandemic in Brazil. We cannot stop economy. We cannot just save lives. He was always saying we need to save the Brazilian economy. And putting economic interests above human lives is the main logic of the Bolsonaro's response to the pandemic. And what we saw as well is in this human rights perspective is that for all the measures that could save lives, Bolsonaro was saying that, okay, this is not that serious. So he was being minimizing the crisis. But when it was a good excuse to foster some of his authoritarian measures, the pandemic was serious enough. So to close borders and not allow any refugee to cross the land borders, because the pandemic is here, it's too serious, so we cannot allow any refugees to cross our land borders. Because of the pandemic, all the detainees will not have in-person hearings with the judge to see if the person was suffered torture, for instance. Let's just do it in a virtual hearing because the pandemic is too serious. Or even one of the first measures of Bolsonaro when the pandemic started here in Brazil in late March was to kind of suspend the access to information law in Brazil. saying that, because of the pandemic, let's suspend and put on hold the access to public information law, which doesn't make sense. And the Supreme Court decided to block this decision. So going back to your first question. And what to expect here, I don't know. I think the situation is getting worse and worse. And Bolsonaro now has 2 more years of his presidency. And we've been seeing in his speech and also in the actions he's been taking that's going to be tougher. He's going to go more and more against human rights and individual rights. So it's urgent in Brazil to have serious investigation of the responsibility of Bolsonaro and his ministers and all the officials involved in the response, because of all the findings we mentioned in our joint research, but also for these responsible to be held accountable. So if it doesn't happen, we will double the death years, and also these authoritarian measures that were taken, using the pandemic as an excuse, perhaps would last longer and longer and stay here. And the pandemic, not the pandemic, but Bolsonaro in the pandemic was horrible for public health, for the life of people, and for democracy in Brazil. So, of course, life are the most important and precious thing, but democracy is also being seriously attacked as we have Bolsonaro as a president.
Camila, we really appreciate you having joined us and your absolutely crucial research in holding the Brazilian authorities to account for the horrific loss of death in Brazil, and lots of things we can learn from in our own catastrophe here in Britain. And it's very important that we learn from the horrors unleashed by our own government's catastrophic respective handlings of the pandemic and the overlapping reasons. Bolsonaro is a far cruder and more extreme example than our own right-wing populist government, but there are echoes which are disturbing enough on their own terms. So we really appreciate you, and thanks for your research and taking time to talk to us.
No, I thank you for, again, inviting me here. And also, if I may just ask the international audience to really pay attention to what's happening in Brazil.
It's very important, and solidarity with Brazil. And I hope everyone who's watching or listening to this does exactly that. Cheers, Camila.
Bye. Thank you.
So in